Great. Thanks, Jennifer, and welcome back, everyone. So I wanted to thank you all for your thoughtful contributions thus far to the breakout sessions that you've been in. So during the present session, we plan to hear a report back from a designated member of each of the etiology and survivorship breakout sessions. So what we're going to do is we will reserve a few minutes at the end of the series of etiology report backs, and also a few minutes at the end of the survivorship report backs for clarifying questions. And then after all of the presentations, we will then open up the discussion to everyone at the end to hear your thoughts about the report back remarks and to add anything that you may think may have been missed during the report back presentations. So please go ahead and put your questions or comments in the chat box, and we'll touch on a few clarifying questions after the series of etiology and survivorship discussions, and then we'll touch on the rest during the open discussion at the end. So with that, I think it's time to start with the first etiology breakout session. And I believe that Amy Kennedy, you were the facilitator of that session.
Okay, yes, so thank you. So I'm reporting back. We're an etiology group, and I appreciate all the members for participating in fruitful discussion. So to address the first topic area, which was highlighted themes over the past couple of days, one of the main things we were talking about was their room for collaboration and how that it's necessary in order to work with the Hispanic community and push this agenda forward. And tied on to that was the importance of international collaborations, that working just in the US, wouldn't find the answers to everything that we're looking for, and that it's not easy. And so it's sort of spun into how can NCI better support and facilitate these collaborations. We also saw another theme as being, which people were pleased with, how cancer epidemiology is relevant for other chronic diseases. So, the talks yesterday from the different ICs, seeing how it overlaps with other diseases and in turn funding opportunities. Another theme was the value in conducting cancer research in Hispanic populations, meaning what we can learn from the differences with other populations. So our discussion was sort of that sometimes it's hard to get funding to do research in Hispanic populations. It may be too small of a sample size, or it may be genetics work that have been done in a white population, but that there's real value in conducting due to the heterogeneity, research in this area to find out new research findings. And the last two had to do with data. So the need to find solutions for missing data, the race questions and how that leaves gaps in the research in terms of missing data, and then disaggregating data. So really understanding how heterogeneous Hispanic Latino populations are. So it's really important to disaggregate data. So cover topics not covered during the past 2 days. The first was in regards to recruiting and retaining hard to reach populations and the challenges in getting extra funding to work with these populations. So what we meant by this was that, working with underserved populations, there's, maybe due to lack of literacy, we're talking about cell phones, how now, research studies may send a text or have an app, but for those who don't have data plans or don't have room on their phone, it's not feasible. So, recruitment and retaining is really hard to do, and it's important and therefore costly. So sort of a discussion around that. We also talked a bit about workforce diversity and the need for greater diversity and having, people being able to connect with the Hispanic populations they're working with. The third topic not covered, people felt talking about the impact of COVID at multiple levels. One being the impact of careers. So, trainees or junior investigators who have struggled like most, trying to get their careers off the ground due to COVID, delays, and then thinking about patient-wise, delays in treatment and diagnosis, people not being able to go to their doctor visits. And then lastly, the difficulties with conducting research when it's typically done in person, due to vaccine rollout issues and, not having PPE, and then especially in international settings, not being able to do that in-person research. And the last one was felt like a discussion thinking about total sort of life course perspective was missing. So there was a lot of discussion about migration, but sort of thinking about migration and generational differences and how the data that most collect doesn't really incorporate exposures from, country of origin and where they grew up, and thought that was an opportunity to discuss a bit more there. So in terms of research questions, you'll see we add dash biggest needs impact. Our group our discussion sort of geared around, in order to ask the research questions, we feel like there are steps that need to be done. And so how can we first address the infrastructure issues needed to conduct research in these populations and have the data to answer research questions? So really, how do we get the right questions asked on surveys, get the right cohorts, create the right consortia, really harmonize data? That's all needed first before answering specific questions. And in terms of data, getting routinely collected data, they discuss the point of needing data to allow for causal inferences, approaches, and understanding mechanisms, not just to really understand etiologic factors, not just confounders. And lastly, for future directions, next steps, we discussed a bit about study section and sort of the need for them to really understand like the issues raised in this workshop in terms of costs associated with working with underserved populations, the potential small sample size, things like that, different methods that would be used. Diversifying the data, it's important, tying to the first slide, to confirm earlier findings. So, doing replicative data in Hispanic populations that it's not been done before. For NCI to work with other ICs at the NIH to advance the research agenda. Having more training on data collection early on in the process, how to approach sensitive topics with vulnerable populations, and why this is important to obtain accurate data. So this was sort of at the researcher level, whether it's a research staff member, a patient navigator, really making sure that they have the appropriate training when they're going out to this Hispanic Latino populations, to really be able to speak to them, and so they understand, why they're participating and why they're being asked for biospecimens and surveys and things like that. Another next step was focusing on the infrastructure development, again thinking about costs and really the time needed to gain the participants' trust, and that it may be different for different populations that they're reaching out to. And lastly, there's discussion on, the need for international collaboration, but there's a lot of barriers. So really trying to figure out how to reduce barriers with grant submissions. The group sort of talked about the difficulty with the bios, subcontracts, limits on spending, and how that would really, it sort of hinders international collaboration. So it's a good next step to take. And I'll end there.
Thank you, Amy. That was a lot of really great information. So now we will move on to the second etiology group, and Stephanie Nelson, you were heading that group.
So I'm reporting back from group 2, etiology, and some of the points, and thanks to the members for the brainstorming ideas, and some of the points that we will present from this group will be, there's some overlaps with what's been covered in etiology group 1. So here are what we thought about, highlighted themes from the past sessions. I think there's an important need to tackle the heterogeneity of the large overall Hispanic populations, particularly in areas where the predominant group tend to be individuals of non-Mexican heritage. So it's important to understand the diversity among Hispanic populations, and considerations of that in our research is really important. The other things that's also came up from these past sessions is sources information. such as SEER or National Survey. Sometimes they do not really consistently define Hispanics, and self-assessment and classifications is not always consistent. Additional topics that's not covered in sessions, heterogeneity wasn't covered as much as it could have been. And it's definitely an important topic in these areas that needs to be defined and more work done to disseminate information. There's a discussions about measurements and tools that develop in other communities might not work in various Hispanic communities. And there is a point discussed about moving between cohort or existing studies with population studies, how population-based surveillance need to be supporting research studies, like how we want to build a new case control or a new cohort in terms of study designs. There's a difficulty in terms of define specific groups. Hispanic population in one region is very different from other regions, and population-based data sets aren't being utilized as much as they could be. And there's also conversation about census data and how it has captured the various Hispanic population and how we can potentially use this data to improve our research in this population. Additional topics not covered in the session. There's a lot of interest about chemical environment besides aflatoxin, how they change over life course with moving from different areas and how they influence cancer risks, the importance of early life exposures. We talk about diet, how sometimes it's very difficult to capture diet across different Hispanic populations. Physical activity, definitely important. Genetics, not only looking at tumor characteristics, but also how germline variation might influence risk. There is a discussion about how lung cancer is important among Hispanics, especially among never smokers. Relationship between metabolic syndromes, particularly higher in prevalence for these populations, how that influence cancer risks. And another point is talking about cancer screening. Cancer screening prevention outreach strategies that tailor to certain cancers that highly relevant to Hispanic populations. And the last topic that, something that we think is important is to define what is common, what is rare cancer in Hispanic populations. In terms of research questions with the biggest impact, we talk about metabolic syndromes, these obesity-related conditions and how that influence cancer risks, environmental exposures among Hispanic populations, and also how cancer profiles, risk factors, how they differ by Hispanic origin. So group one already covered this in terms of generations moving from different regions, how that influence lifestyles is really important to consider. And also the last point is about cancer screening, access to care and prevention outreach strategies that tailor to specific cancers that are relevant to Hispanic populations. In terms of future directions and next steps, we agree that identifying existing resources and cohorts that have collected data are important and how we can pool the data, harmonize the data together. The other thing is we talk about how we can maximize consistency and completeness of this existing data. Improving cancer surveillance system among Hispanics includes, getting a more accurate survival data, getting more complete birthplace and specific origins are important. And also the importance to highlight Hispanics are heterogeneous population and researchers and data needs to be sensitive to this knowledge. And also more qualitative and mixed method research is needed and more community engagement. And the last section is what's covered by group one is to engage more Hispanic researchers, more funding, more training, more informational sessions for researchers to let them know what is available, what we know about SEER and other resources that they might not know about at this point. I think that's all I have.
Thank you, Wendy. That was a really great summary. So we will move on to the third etiology group. And I understand that Todd Golden, who will be presenting your summary.
Yes, can you hear me okay?
Yes.
Okay, perfect. Just wanted to confirm. Hi, everyone. Yes, my name is Todd Golden. I'm a second year fellow at the NCI, and my fellowship is actually focused on understanding the impact of COVID-19 on cancer care across the United States. It's my pleasure to be reporting on Etiology Session 3 that was led by Tram Kim Lam. So highlighted themes from the past sessions, we had a few themes. Number one, as you heard from others, the diversity and heterogeneity of the Latino population across the United States, and the importance of sharing what we're doing and who has access to different types of information.
Sorry to interrupt, Todd. We only see your first slide.
Oh, okay. One moment. Thank you for alerting me to that issue. How about now?
Yes.
Okay, thanks. I'm sorry about that. I was just going through the answer to question 1. So in addition to diversity and heterogeneity, which was mentioned by the other groups, we also talked about the importance of collaboration and not knowing as much about what others are doing and how we might work together to more efficiently understand larger populations and increasing our knowledge base. And as well, there was some discussion regarding to the need to knock down the wall between intramural and extramural research that perhaps has existed in the past. And one of our participants also talked about, they were very excited about the biologic resources that were touched upon. The next highlight we categorized under definitions and terminology, which I think was also mentioned by some of the other groups, but really the importance of defining terminology in order to do the research, particularly in terms of recruiting patients and continuing longitudinal understanding. One of our participants touched upon the importance of, as a clinician, being a part of the research, and there, here's the next 2 themes. Thank you, appreciate that. The next 2 themes from our first question were we categorized under trust and childhood cancer. So in terms of trust, there was a discussion in regards to getting the general public to trust the researchers when we're trying to recruit for studies, which is a major issue, particularly in the current political climate, and that it would be really helpful, and the importance, of course, of community participatory research in assistance with this research recruitment. And then finally, childhood cancer. So there's a limited understanding of childhood cancers in the Latino Hispanic population, especially ALL, and the need for more studies on environmental impacts on children, as well as the rise and the role of childhood obesity. In terms of topics that were not covered in the sessions, we had a few themes. One was, how did cancer become a major cause of death for Latinos? How did it rise to the top, and what factors are contributing to this? The importance or the value of a job board or a forum would really assist the creation of opportunities for collaboration and recruitment for researchers interested in disparities research in particular, and I'll touch upon that a little later in this presentation. The importance and the role of education. So how are we giving opportunities to the community and the next generation of researchers? And that is thinking about the changing demographic of the United States population. And we had the opportunity to hear about a training program that talked about the value of finding a mentor and matching with mentors and preparation for doctoral programs, particularly for researchers from the Latino and Hispanic communities. Several other topics were identified as of interest to the group. So one was the cross-cancer risk factors, the role of environmental factors, and that of genetic research which may point towards risk factors across different cancers, and really the importance of inflammation and obesity as well. Another theme was the impact of obesity across the life course overall in research. And finally, the dissemination of findings to the community. So again, our group really thought the role of the community would be of value both as researchers, as participants in recruitment, and of course, as a role in disseminating the findings and collaborating with the community essentially in every step of the process. And building trust, of course, would be key to all of that. In terms of research questions with the biggest impact, there are 2 slides, the first of which is here. The importance of understanding the heterogeneity of the population in order to investigate the common threads as well as environmental factors and differences across different cancers, as well as the contribution of genetics in combination with and separate from environmental risk factors. There's much more to learn. Coming back to the childhood cancer theme, we really focused on the fact that 1 in 4 children in the United States are Latino, and so we really need more of a population-based study with regards to cancer in children. And we talked a bit about the new National Childhood Cancer Registry. And then the importance of improved data collection. So a couple of things under there, you can see the age when study participants came to the United States, as well as their country of origin for longitudinal research, the genetic variation, granular clinical information linked with registries, as well as the linkage with death certificates for improved survival. The second part of this question was, is the treatment and diagnosis that have been developed in predominantly white populations applicable to Latino Hispanic populations, and are they receiving the right treatments and diagnoses based on their genetic backgrounds? And finally, the improved cancer registration in Mexico, as well as other countries, particularly in Central and South America, were things of that folks in group 3 were very interested in. In terms of future direction, we had a few themes listed here, and I will expand upon them. But first, we had expanded resources. So we spoke about how barriers are an impediment to the work, particularly funding. There's not enough resources for research itself, as well as the nominal incentives for patients participating in research often. So for instance, there is particularly modest amounts often provided for participants who are providing blood draws and doing quite a bit as research participants. In terms of collaboration, we talked about the value of consortiums and how scientists could collaborate by cancer type, and that it would be of value to both patients and researchers, and essentially that we would want to really work together. And then in terms of opportunities for young investigators, which I touched upon a little bit earlier, we really talked about how it's often very hard for some new investigators to start out because they don't have a track record. And it's hard to have a track record if you're not able to start out. So we talked about pilot studies and grants for early stage investigators to jumpstart their careers, as well as linking new investigators with more senior investigators across institutions, especially linking younger investigators outside with those outside the United States. And we did talk about how large cohorts participate in research, but often request fees that might make it hard for them, for new investigators starting out. In terms of policy implications, we talked about really the infusion of fast and processed foods, as well as tobacco promotion in Latin America, as well as other low and middle income countries as a whole, and the epidemiologic transition, as well as childhood obesity, especially in the generation of children that are born in the United States. In terms of high risk and high reward research, we talked about how there's sort of a lack of funding in this regard, and that it would increase the pool of researchers doing etiological studies. And just to reiterate comments that have been said, we really thought that it would be of value to have increased diversity on review teams themselves, and really a better understanding of race and ethnicity as a social construct. So how we even ask the first question, how does someone identify themselves? I think I'll stop there, but I really appreciated the group, and I think I'll stop right there. Thank you.
Thank you, Todd. You made a lot of really great points. So we will be moving on to our fourth and last etiology group report back, and I will pass it over to Gabriel Lai, who will be presenting, I believe.
Yes, thank you, Rachel. I think I'm gonna share what I can. I believe this is the one. Rachel, and others, do you see the PowerPoint screen? I just stick with this.
Yes.
Okay, thank you. So one, I want to thank everybody who participated in the etiology number 4 session. I also wanted to give a shout out to Catherine for organizing these notes in a very meaningful manner, because we had a very, I think, a very lively discussion, and a lot of things went back and forth. And so hopefully these bullets that we cover will capture reasonably the things that we discussed about. And so with this, the highlighted themes that people that were really struck by, there were some who noted that they weren't as aware of the disparities in Hispanic Latino populations, but that they were made more aware of existing disparities in cancers. And then someone noted about liver and gastric cancers, so that was something of particular note. And as well as the lack of representation of Hispanic Latino participants in cancer epidemiology studies. And so that was something that I think some also as well noted. By multiple people, there was an importance in the highlighting of the need for disaggregation of Hispanic Latino subgroups. And there was also the note and the challenges in capturing particularly mortality in Hispanic Latino groups in registries. For topics that that people reported that weren't really covered in sessions, I mean, there was a number of things, and you can see there's a list here. And this included the understanding of the cultural and genetic diversity in Hispanic Latino subgroups as they impact cancer. Even though there was some discussion about it a little bit yesterday, but there was perhaps a desire that there be a need to take advantage of existing data and biospecimens to conduct research, including Hispanic and Latinos and other minority populations. Probably in this day of age of COVID, there's perhaps a call out for the need for studies to evaluate the efficacy, barriers, and challenges to screening and vaccine uptakes. And there was, what was also identified was the need for to look at modifiable exposures and perhaps tools, appropriate tools that were applicable to Hispanic Latino populations. There's also someone brought up about the importance of addressing structural barriers to participation for the Hispanic Latino community, and that there's definitely a great need to be much more inclusive for both undocumented and documented participants. There was, in terms of this organization for research questions with the biggest impact, there was a big call and discussion about the comparison of cancer incidence and risk factors between US-born and foreign-born Hispanic and Latino groups. And the second bullet talks about the impact of length of residence in the US and mortality. And even though it's a little bit of a smaller bullet, it dove into a greater discussion about perhaps the importance of environmental exposures, environmental risk factors, and perhaps then seeing on the differences between US-born versus foreign-born groups. And this is one of two slides for future directions and next steps. And we had a lot of discussion about this as well. One of the things that we talked about, and that comes to hit us at the NIH and the extramural side, is that there was great difficulty in getting Hispanic Latino cohorts funded by the extramural community, and that there was perhaps a call out and a need for more investments to increase the diversity of NCI and NIH supported cohorts. And that did delve a little bit into discussions about the importance of study section itself, about the evaluation of these applications. And there was a notable lack of diversity in these study sections. So something that it was important and something that we can definitely keep in mind at the NIH. There's also a need for stakeholders at the table for Hispanic Latino related research at all points of research development. And in general, it's been very much of a top-down approach, and it doesn't necessarily effectively engage with community members. The third bullet is related to the importance of disaggregated information, and that there really needs to be greater efforts toward disaggregation of Hispanic Latino subgroups in research. And we all have been hearing that big call out from the very beginning. In terms of research, there was also, I mean, we got into a little bit about this, about discussion of race and ethnicity earlier in the meeting, but that there's definitely a need for more representation of Black Latino and Indigenous Latino subpopulations in research. And there's definitely this idea that, you know, just as we know about the Hispanic subgroups, there's definitely more, I suppose, quote unquote boxes to check off, or more in terms of getting people to be represented in these areas of research. And there's also a call for more efforts to increase the feasibility and retention of Hispanic and Latino participation in cohorts as well. One thing that was important to note was to have perhaps empower and leverage existing centers organizations that have a catchment area with a high proportion of minority participants as well as researchers to help increase the community engagement. There is a desire that there would be more of a focus on environmental disparities or environmental and justice research. We also talked a little bit about how, since we mentioned, it was brought about the issues of the salmon effect or the salmon bias, about how there perhaps is really important to collaborate with others outside of the US, and that there be international collaborations, perhaps even with other the NCIs in Central and South America, in order to capture perhaps how migration impacts accurate reporting of cancer mortality rates of the population. And that kind of naturally segued into discussion about these collaborations could also help, increase opportunities to highlight other people's work to promote the networking and awareness of work in the field. And so this is something I think that this was something I think we felt was really important, just judged by the nature of the conversation. And I think I just noted that one thing that it wasn't talked about, of course, was perhaps the support at multiple levels for cancer registries and in many Central and South American countries, because trying to capture some of this information, it would be very difficult if there weren't any registry data in these other areas. And then there's also the importance of highlighting community engagement efforts and workshops, because I know that sometimes some of our current workshops, and like this one we're having right now, is on certain areas, but perhaps the importance of if future workshops or talks could also highlight these engagement efforts to help increase collaboration, or perhaps increase the engagement of Hispanic Latino participants as a necessary next step. And I believe that is it from our group. Rachel.
Great, thank you, Gabe. That was nice hearing all of your group's comments. So that concludes the etiology portion of the presentations. And I see there have been some nice comments going on in the chat regarding the importance of supporting not only early stage investigators, but also senior investigators to be able to support the early stage investigators, and the overall importance of supporting Hispanic researchers. So I will open it up just for a couple of clarifying questions regarding the information that was presented in these slides. Does anyone have any clarifying questions? You can go on and put them in the chat. So let's see. We have one comment that says, in reviewing grants focused on cancer disparities, the inclusion of URM investigators and trainees should be considered as a score driving issue. That's interesting. And then let's see. I'm trying to read through these comments as they come through. And then we have another comment about providing career support for investigators. Yes. Yeah, I love the career support chat that's been going on. Does anyone have a specific question about any of these thoughts that have been put forward in the presentations? All right. So I don't see any questions. So I think what I'll do is move on to the survivorship portion of the presentations. So we have 3 survivorship groups, breakout groups that met and discussed, and I'm excited to hear from all of you. The first group that I have on my list was moderated by Lisa Galicchio. Lisa, are you going to be presenting your slides?
I am not. Kathy Semenyoa from UCSF is going to be our presenter. So thank you, Kathy.
Sounds good.
Thank you, Lisa. Thank you to our moderator, our reporter, and the rich discussion that we had in the group. So everyone can see my slides? Yeah. Okay. So a lot of what we discussed has already been mentioned, so I'll try to briefly go over that. So some of the themes that were highlighted from past sessions was the large historical, cultural, and genetic diversity across Hispanic populations that really bring up how complex and nuanced classifications in data collection can be, and can make the epidemiological and statistical plans difficult. There was a depth of resources, existing resources that were noted, but we would like to see possibly a one-stop shop to get a sense of what studies have been conducted in Latino populations, what cohort studies, what resources are available, and what data elements. Dr. Talavera mentioned the SOUL study that is planning to link to Cancer Registry. So that's just one example of how we can leverage existing studies in Latinos. And another theme that was highlighted that was notable for us was the engagement with local communities, which is key. And this brings up one of our later points about the need to engage community to build trust. We see some of the hesitancy with COVID-19 vaccinations around trust in science or the scientific enterprise. So we think that's going to be important too. Some of the topics that were not covered in the sessions were the need to educate and engage the Latino population and the importance of participation in research. There was also discussion of the need to translate research tools into Spanish. A lot of studies that are conducted just in English or use just English language surveys are really being, they're excluding the Latino population that is Spanish speaking. It's also important to make research accessible to the Hispanic lay community. So there's health literacy issues around this. And among the aging Latino Hispanic population, we see that there's this paradox of longer lifespans, but quality of life issues, disability later life, comorbidities, things like that are really understudied. And there's a need to understand the survivorship needs of Hispanic Latinos and symptomology related to their cancer, such as topics around sleep and stress. Some of the research questions that were highlighted in our session, in our discussion with possibly the biggest impact was, again, understanding the psychosocial and symptom outcomes among this population at the population level. Also examining the impact of multi-level factors on cancer-related outcomes, such as policy, community characteristics, zip codes, green space, patient-doctor, racial ethnic concordance, language concordance, and again, the theme of US versus foreign-born Latinos. We also discussed examining the Hispanic cancer survivors interaction with the healthcare system. We know that the healthcare system can be challenging to navigate. And then the Latinos tend to be underinsured or non-insured, and there's issues with having Medicare specifically for older populations. Do they qualify because of different like immigration status? Do they qualify for things like Medicare? So it'll be important to look at if they experience more delays in care compared to other groups because of factors like this. Other questions include perception differences that impact various survival outcomes, such as the influence of caregivers on decision making. We know that familiarismo is big in the Latino community, and Latinos tend to consult with their families regarding diagnosis and choices down the line. And another question that was brought up was, what are some of the generational differences among Latinos? This can kind of get at acculturation, but specifically we were talking about generational differences and how this may impact cancer outcomes. And then I think that was the last slide. Lastly, the future direction or next steps is, again, more discussion, consensus on Hispanic data collection with novel approaches to aggregate some of these data. And there's toolkits like the Phoenix toolkits that will kind of address this need, but I think that there's opportunities to better publicize these toolkits. we saw an opportunity also for resource building, where potentially a dashboard of the Latino Hispanic studies of cohorts, resources, and data elements can be put on there that will really leverage these studies and also encourage collaboration across institutes. The third point was data integration approaches for landscape scans and to get more quantitative data on the prevalence around survivorship outcomes. The lack of Spanish language patient education materials, such as videos. A lot of survivors will get referred to outside sources, and we see that there's a lack of resources in either videos or websites or patient navigation portals. So this could be an opportunity for and call to action for NCI, ASCO, and other advocacy groups to work together. There is a need for NCI to facilitate the increasing representation of Hispanic in existing ongoing databases, and the need for language and race ethnic concordant researchers in the community. So this kind of talks to the point about supporting early stage investigators, supporting established more senior investigators, and also potentially for NCI to create a mechanism by which others have modeled this, where there's funds allocated for trust building and for community engagement. And this can really impact the recruitment retention of Latinos, and this has the potential to really impact the community at large if we have more trust, or I would say if us as scientists are more trustworthy and we communicate that with the community and work alongside them, there's an opportunity for greater impact in our work.
All right, thank you, Kathy. That was great. I will move on to the next breakout group, which was moderated by April O.
Hi, can you see my slides?
Yes.
Okay, great. Hi, everyone. Thank you for that really nice summary, Kathy, and work group 1 in survivorship. I think that we'll probably build on and add to, but there's a lot of similar themes discussed. Just want to acknowledge all the breakout group members and our note taker, Lou Rambo. Thank you all for sharing your great ideas, and I appreciate you trusting me to share back what we heard. But please also, work group members, as I am sharing our slides and our summary, please feel free to add in the chat if I am misrepresenting anything or inadvertently missing something. So some of the highlighted themes that were shared and identified in our work group was there was a lot of excitement to hear, and it was encouraging to hear how much is happening in this field, and really unique opportunities for collaboration, better connection, and workshops like this present this opportunity to facilitate cross-learning and sharing of experiences so we can extend and build the science. What was underscored was the importance and challenges of disaggregating populations and the need to do a better job of capturing Hispanic origins struck our work group. And would like to do more in building opportunities for sharing of methods, data sources, and standards, and identify how to incorporate new data that is coming in and ways to combine and synthesize all of that as we approach different disparities, research questions. There's also a strong impression with the international collaborations that were presented over the past couple of days. And how is it that we can potentially as a field come together to address any barriers in the future? So it may not take as long to establish or sustain these types of global collaborations. There's some thoughts on additional topics that may not have been covered in sessions, and I think that Kathy probably covered some of these too. We had quite a discussion about the struggle of long-term sustainability of studies due to some challenges related to funding, but also there were some ideas presented by our group of potentially some seed money or also some funding mechanisms that might support sort of pre-design or relationship building type studies. There's some challenges of genetics and ancestry, challenges related to analysis of self-reported race, ethnicity, and ancestry that we thought could potentially be covered, and there's opportunity for more discussion to build towards standards or best practices. Related specifically to survivorship, an interest to discuss more deeper some of the treatment disparities, sorry for that typo here, access to care issues, insurance, and then also how to build and extend care coordination, identification of key survivorship variables for this community across cancer sites. And as Kathy has highlighted, there's some unique communication challenges, linguistic. There's also some areas of health literacy to also explore, tying in again some discussion around navigation. We also discuss the opportunity to bring in topics related to experiences of discrimination, stigma, and systemic racism experienced by patient survivors and in the healthcare setting, as well as within our research field. Incorporation of neighborhood factors such as neighborhood, built and social environment, thinking about the role of ethnic enclaves, the positives and sort of the barriers that could be a part of our work, and also on the outcomes we're looking at. Some practical advice in within our community of research around cultural and behavioral aspects of recruitment and adherence. More attention to subgroups, understanding prevalence and risk in different subgroups, for example, children and also women and sort of non-traditional female cancers that was brought up, and also incorporation of the voice of the survivor. So some of the biggest research questions that we talked about for potential big impact are these three here listed here. What are the unique risk factors in Hispanics that affect long-term survivorship, identifying those at the greatest risk for worse survivorship outcomes? And we talked quite a bit about comorbidity management and control that may affect survivorship among Hispanics, talked about some other outcomes such as obesity. And then I know there was interest in our group around some other health behaviors as well. And how do we provide care coordination and navigation to better improve Hispanic survivorship? We brainstormed some future directions and next steps. First, building off of the work from this workshop, identifying and extending and building collaborative networks and extending that work to the international space. Some opportunities to discuss, establish, and develop standardized methodology and measurement, extending to different platforms and spaces, including leveraging the EMR, funding, identifying funding mechanisms to support sustainability and even some bridge funding from existing pilot studies or projects, encourage multi-level studies that will look across different levels and influences, some key questions on how to measure ancestry. And then there was some discussion too around biospecimen storage issues and challenges and opportunities for maybe sharing these different samples collected across multiple studies. Is there a way to coordinate how that storage can be sustained, as well as that data can be shared across research groups and networks? I hope that I captured our group's feedback and ideas, but again, invite them to go into the chat to share more. Thanks, everyone.
Thank you, April. It sounds like you guys had a really nice discussion. So I will move on to our final survivorship group, and that was moderated by Joanne Elena. Joanne, will you be presenting?
I will be, and I really hope I can share my screen. Let's see if I can do this. I was hoping to make it through the whole workshop without having to do slides. Because I've seen everyone else. Okay, you can see this. And then I just need to, great. Okay, great. I could have talked with this group all day long. It was just a wonderful group, and I feel very fortunate. I hope I didn't miss any names, but really feel fortunate. Okay, so many of the same themes that we've heard from our other groups. We really thought about how robust data collection methods are needed, and then they need to be able to follow people and additional outcomes at various time points because of the inherent biases we've been talking about throughout the conference. Registries are so powerful, but because of the way the data is collected, there are some inherent biases. And we thought maybe cohort studies may not have they wouldn't have the same sort of biases. If you start with a group from the beginning that identify as Hispanic and Latino, then there won't be as many questions about who needs to be included from the start. But then there are different issues with representation. And so we thought it was important to emphasize the registries. There might not be enough awareness of the registries throughout different research institutions, and then the methods that you may use to analyze data from cancer registries. Census data was also brought up, but of course it has its own challenges with confidentiality and not collected just for health research. Something else we wanted to highlight was the positivity of culture and how that has ramifications for treatment, reversing the Hispanic paradox. And I should have fixed this because later we talk about, we really need to watch language that is discriminatory. It shouldn't be a paradox that you would think that there is a good outcome with Hispanics. So really what we wanted to do is focus on the positivity and the culture and the good things as well. We talked about the definition of the Hispanic Latino, trying to capture ethnicity and all the things involved in that complex ancestry and genetic diversity, but then cautioned against disaggregation. It's important to have the specificity, but if you look at a group that's 1/3 of the population, perhaps that should translate towards 1/3 of the participants in a study, 1/3 of the research dollars. I'm speaking as the moderator of the group, not as an NCI person right now. But the quote that came from our group that I really liked was, what's the difference that makes the difference? So how do we really capture that effectively? Oh, also my group, please, as I said then, please jump in. And if you want to speak, just raise your hand and ICF can unmute you. That's our contractor, can unmute you and you can speak to. So topics that were not covered in our session in the last 2 days that we talked about were patient-provider interactions, treatment adherence, communication patterns in the family, especially some nuances around pediatric and adolescent young adult, parent, child, physician relationship, that trust and communication. Trust was a big theme in our group, trust in the medical system, trust in your care providers, awareness of registry and information for researchers. Oh, yes. So just getting more disseminating the resources that are available for people to conduct research. We also talked about methods for better, for trying to understand missing data using sensitivity analysis. And we talked about using data that was captured from a time where Hispanics were more invisible, and with visibility comes an opportunity to capture better, but we do need to understand how to use data that may not be capturing ethnicity in a way that's most appropriate now. Risk models to building, I don't know if risk models is the right word, that was my word, but trying to understand how to take a set of variables and really build a profile that is getting to the information you want. Maybe it talks about nativity and whether Spanish is spoken at home and where grandparents are from, but trying to create a more full-fledged assessment. And then we wanted to see more information on resiliency. This was hard, but trying to pare down some research questions. How do we get better ethnicity, origin, ancestral heritage into our cancer registries? What are differences in outcomes between foreign-born and domestic-born cancer survivors? what are the comorbidities or chronic conditions that are most affecting the survivor population? So thinking beyond cancer outcomes, but as they affect cancer. How do we best integrate cancer treatment history and patient-reported outcomes, social support, information into research? This isn't unique to Hispanic Latino cancer survivors, but certainly a big problem in research, because if you receive care in different places, maybe for this population in different countries, trying to integrate that to get a full picture of what your exposures have been from cancer treatment. And then how to manage funding. How to manage, so we talked about maybe trying to figure out additional ways to supplement missing variables in data registries, and maybe piloting new ways to collect information, and like with many other groups, funding became a very important part of this. How do we enable people to collect these kind of methodologic questions? Our future directions and next steps, again, mentioned several times that we need better methods for addressing sampling bias, maybe sensitivity analysis, a comparison group. Often kind of as a knee-jerk reaction, I think reviewers will say you need a comparison group of white non-Hispanic participants. We said that's not necessary, but when including a comparison group, who should they be, what's appropriate, and also kind of trying to change that frame of mind to always compare to someone else, not needed. Using patient-reported outcomes to validate clinically collected data and to add to existing information that may already be collected in an existing study or a data registry. Again, big theme with us, trying to get better data collection and registries, increasing the participation in clinical trials and research studies in general, really trying to mine data and build upon and build to some of these large NIH initiatives like the Childhood Cancer Data Initiative, all of us, and maybe pooling some cancer registries. We talked about the rich amount of data in these endeavors that may be particularly useful. Better capture of ethnicity for everyone receiving care at cancer centers, and then really working to QA, QC, how to assess this, make sure that minimal set of questions, because we talked about not trying to add to the burden of cancer survivors, but trying to get good information. And then I mentioned this earlier, but exploring the language we use in research. We didn't think great things about the term Hispanic paradox, and our group didn't. And then the final thing was really encouraging funding for representation in Hispanic Latino researchers and cancer survivor researchers. Really, a lived experience informs this work, and we thought that was important. To my group, please jump in or add to the chat. And I will stop sharing.
Thank you, Joanne, and thanks to your group. That was a lot of great food for thought. While you and others have been presenting, there have been a lot of great comments in the chat. I'll just highlight some of them. Tram put up a link to a great childhood cancer article, and there's also a plug for Dr. Sharpless's presence or speech at this workshop that will happen at 4 o'clock today. There were also some people talking about the importance of acculturation and global warming, the importance of looking at variables including family, social support, and spirituality. Are there any questions specific to the survivorship presentations? I don't see any questions specific to the survivorship presentations coming in right now. So we have only about 10 or 15 minutes left until the end of this session. So I'll open it up for a group discussion, and you can feel free to put your comments in the chat or raise your hand and I can call on you. And you can feel free to comment on the content of the presentations, add on, or just bring up anything that you think has been missing from this conversation currently. And I already see one hand. I see Amelie. Do you have your hand up? Would you like to ask a question?
Yes, thank you. I wanted just to add that it's important to look at our instruments that we're using, because many of them were developed for non-Hispanic white populations, and and those are the standardized instruments, but sometimes they don't really capture things that we're looking at. For example, depression, or even some of our, I think it's come up in some of the recommendations, like the acculturation type questions and things like that. We haven't had any new recent research to really look at those questions for those Latinos that are born and raised in the United States, for example. How do they react to some of these questions, and how should we need to tailor them a little bit better? So I think we really need to look at some of the behavioral and social behavioral questions areas that we've utilized in the past, and to see how valid are they with our populations. Thank you.
Oh, that's really interesting. So looking at the validity of current instruments that we have to capture, especially social behavioral data.
Mm-hmm.
So Luis, you moved on my screen. Luis,
I would like to, Amelie, I think most of these instruments were not developed in Latinos, and also something that it should be considered is the language use and the reading level use. When we do surveys here in Latinos, or we start in 6th grade reading level, right? As I said, most Latinos are linguistically isolated. Well, a good fraction are linguistically isolated, so actually don't speak Spanish. But some other topic that is important for our community, and I don't know if there are tools developed for this, is the fear of deportation. The constant fear of deportations that many people in our community have, particularly because we have a lot of families with mixed immigration status. That has terrible. I mean, if you saw the news about family separation, or have seen the news about family separation and adverse childhood events, those events have long-lasting effects, and I'm sure also affect cancer survivorship. I don't know if anyone is aware of that, but there are a number of specific aspects of the Latino community that I doubt are captured by existing surveys.
thank you for that comment. Yeah, so your comment had to do with stress, basically childhood and adult stress, and particularly deportation and the effect on health. That's interesting. So I am looking, I have 4 pages of people here, so I'm just looking for raised hands. All right, so I am going to go to the discussion and see what's going on here. We're talking about FedEx as a one-stop shop. Interesting. Does anyone else have anything else that they think is very important to talk about that wasn't covered by these breakout sessions? So what do you think about maybe some of the recurring themes? I just was making a list of some of the recurring topics, just words of recurring themes. Trust, the importance of figuring out missing data for this population, the importance of acknowledging the heterogeneity of Hispanic populations, life course perspective. Does anyone have any comments about any of the recurring themes that they saw across these breakout presentations? Anyone? Does everyone agree that there were a lot of recurring themes?
I think that there were several, the heterogeneity, the need to look at the risk factors that cut across, many of the cancers impacting Latinos. These kinds of things were, readily stated. The funding and the resources needed to do the kind of research. In our session, I mentioned that, NCI has not increased the R01 budget in a long time. And we, in order to do a lot of the more intensive biological data assessments that we want to do, it's more expensive now. And so I think all of those things are important. The mentoring is and the training of our future, individuals, as well as, really working closely with our community to, as Lee said, just developing that trust with our communities is extremely important.
Yeah, thank you, Emily. You're right. I saw a lot of recurring themes having to do with the topic of funding, which is, of course, very necessary for research. Does anyone else have any thoughts about recurring themes that they saw or future directions based on what they heard from these breakout groups? You can either raise your hand or put your comment in the chat. And so there was one comment that some of the existing standard instruments don't have scores for Spanish speakers. And I think that might be related to an earlier comment that that Amelie had about the need to really put some emphasis on the tools that are out there, or the instruments for data collection. Does anyone else have any just overarching comments about their experience with the breakout sessions and how it sort of pulled together some themes from the workshop?
This is Manuela. I just wanted to comment that I just thought it was an incredibly inspiring series of comments, and just for some of us in some areas, these sorts of conversations don't happen, even though I'm in New York. Just this kind of richness. I haven't heard this kind of discussion except in really small circles. And so it's just thank you to NCI for pulling this together, and thank you for people for being so candid in describing challenges. So it's just wonderful to hear all this from my end.
Thank you, Manuela. Yeah, it's been a really unique opportunity to get people passionate about this topic together from different arenas of the research field. And Nydia also said that she thought it was very refreshing to be able to share ideas with everyone.
I think there's opportunities for NCI to collaborate with maybe NIEHS, because many of our Latino communities are working in the service field, the agricultural fields, and so forth, where they are exposed to a lot of different types of pesticides and toxic type chemicals. And we just don't know the influence that the environment is having on some of the cancers that we're seeing with our population. So maybe that's something that you all might want to think about.
Thank you for that. I know in my own breakout group, we talked about the importance of environmental factors in research in Hispanic populations. Thank you.
Rachel, may I make a comment? I wonder, after hearing all these great summaries, if it would be possible at the end of the meeting to come up with a listing of all of the participants and their areas of interest, perhaps, because I think if we could share this among ourselves, it would facilitate conversations.
Thank you for that. I don't know, I can't confirm right now if it's possible, but I've noted down your comment and we'll figure that out. So thank you.
Thank you.
So let's see, we have one more comment that some common themes. So finding ways to increase community engagement, facilitating international collaborations, particularly with investigators from Latin America. Yeah, I agree. I'm reading these comments as they come in. Let's see. Being with other Hispanic Latino investigators who are facing similar challenges is very important. I agree. There is definitely power in collaboration. And if NCI can support the formation of Hispanic Latino researchers with an interest in epidemiology network, again, I can't confirm if it's possible, but your comment is definitely noted. So we have just a couple of minutes left in this session. Does anyone have any last closing comment they'd like to make? No? All right, I know I've really enjoyed all of the information that's come out of these breakout sessions, and it really seems like a lot of you were just you seem very excited about having been able to share ideas with your group, and so it was great hearing back from everybody. So I wanted to thank you for participating in these discussions and for your contributions. And I think that this discussion has generated a lot of thought about future directions that we need to take in this field and research questions that we need to attack in the future.